Welcome to Chamber Chat. I'm John Terr, President and CEO of the Boulder Chamber, and I welcome you to another edition of our opportunity to talk to business leaders and community leaders who are helping to support our businesses, strengthen our economy, and lift our community. And today we're going to have an important and exciting conversation with my good friend, Dr. Rob Vissers, who is the CEO and President of Boulder Community Health. And we're talking to him on the occurrence of their 100th anniversary celebration. So we're going to have a great conversation about the role of the hospital in our community and its history, legacy, and an important element of our economy. Before we do, just a couple of announcements from the Boulder Chamber. First, we have our Women Who Light the Community nominations coming up, but we're not fully at the nomination period for all our business women leaders. This is the period when we announce or ask for nominations for our Emerging Youth Award. And that's somebody, a young individual in our community who is doing amazing things and needs to be recognized for their efforts. And we try to do it before the school district's out, so we make sure to get a lot of great nominees. And the eligibility, let me just run through those, must be a current enrollee at Boulder County School, or homeschool program from between grade 8 and 12, has held a leadership position or demonstrated excellence with an organization and having great significant impact through that effort, or that they are demonstrating a committed effort to the cause. And then finally, just want to make sure you know that this Emerging Youth Award winner will not only be recognized at our Women Who Light the Community Awards event, which is just a spectacular gathering, but also they will be receiving a $1,500 scholarship. So it's a significant award for an emerging youth. And make sure to get those nominations in by June 24. Okay, so that's Women Who Light the Community Emerging Youth Award. Make sure to get those nominations in. And then two other announcements. First of all, we have a business after hours, those great opportunities to get together, lubricate those business-to-business development opportunities at a wonderful place to be named later. And actually, correction, that was a business before hours. There will be no lubricating beverages, but that's on Thursday, May 12th. And it's going to be at a location to be determined. So business before hours. We might edit that out or not. We'll see. And then second, or last, a beer with John. And this one is at Avery Brewing. And it's such a wonderful establishment. They have so many creative craft brews. And it's a great chance for me to get connected with our members, answer any questions you have about the Boulder Chamber, have a little bit of one-on-one dialogue. So make sure to show up at Beer with John. That's going to be at Avery Brewing. That's Tuesday, May 17th from 4:30 to 6 o'clock p.m. Okay, enough from the Boulder Chamber. Now we're going to get to our conversation with Dr. Vissers. So Rob, first I'm just going to ask you, it's an interesting celebration of 100 years. So what is that history of Boulder Community Health in Boulder?
Well, I wish I had the time to go into the detail of the history, because it is amazing and impressive, and it follows along the incredible growth of Boulder itself. But in terms of highlights, it really started about 1920, so over 100 years ago. And the healthcare here was provided at a small hospital on campus as part of the University of Colorado Med School. And the decision was made to move the medical school down to Denver, where I assume where the population was, and that's not that unusual for other health systems that came out of a university setting. But the physicians in the community were wise enough to say, well, we still need care.
Yeah. And
they worked it out that they were able to continue to manage and work through that facility for a couple of years until they could basically build their own hospital.
Now wait, I understand the Boulder Chamber may have played a role in that effort to manage that hospital, is that correct?
They did, yes, yeah,
right.
Absolutely.
Yeah,
Absolutely.
History of the Boulder Chamber.
And in fact, the Boulder Chamber, the citizens of Boulder, the physicians, the community truly came together and built this health system and hospital, and so it was built by and for the community and continues to be, in all intents and purposes, owned by the community. And so 100 years later, it opened in 1922, and 100 years later, we remain a community-based, independent, nonprofit hospital here to serve our community, Boulder and the broader Boulder area and the surrounding counties.
It's quite a legacy. Well, another legacy is the amazing service that Boulder Community Health provides to our residents, and in particular recently in a moment of crisis of the COVID virus, responding to that health care situation. Tell me, what impact has that COVID experience had on the hospital and on the facilities?
Well, thanks for asking. The impact on us has been profound, and I think at times now that we're coming out of this, and I'm happy to say that as of early this morning, there were 0 COVID patients in our hospital. 0.
So wonderful to hear.
So that's exciting.
Yeah.
And but it was really a testimony to the legacy of the 100 years. Obviously, things didn't stand still for 100 years, and we continued to add services and providers and experts. And when I came here 8 years ago, and I'd worked in very large inner-city level 1 trauma centers, I was blown away by the depth of the care, the breadth of the care, the expertise and the commitment of the physicians, the quality of the nursing staff and support staff, every member of the organization. It was just hard to believe that this could take place. As unique and as Boulder is, for the size of this community, I thought it was just what a tremendous privilege to be a part of this. That was really revealed during the last 2 years, and the willingness of our staff and our providers to come together. I would walk into the vaccine clinic, which, by the way, was such a tremendous difference maker, and all the people giving out the vaccines were docs that had retired 5-10 years ago, and we're so grateful to come back and be a part of this and lead this effort. The willingness of them to come and work in the hospital, and then the support of the community for us, and the recognition of the value of having an independent nonprofit health system really resonated. But also the expertise and our ability to navigate this really complex disease definitely shone. And while lives were lost, and it was very devastating for our population, our patients, our families, and certainly our staff, I believe in my heart that we came out of this in as best a possible way as we could, and frankly fared much better than a lot of other communities because of that 100-year legacy and the investments and the time and the commitment of the community and the docs. It was in my career, it is my most proud moment, and it really I think was very meaningful for our staff and our employees as well. I don't want to take away from the challenge and the difficulty, and but the level of engagement and resiliency and support, and now coming out of this, the excitement about being able to move on and continue to care and get back to what we do every day.
It's fascinating. I mean, I can tell you that I was riveted by your reports regularly to City Council, just helping us understand what is the gravity of the situation, and then just the magnitude and professionalism of the response. Gave great confidence for folks who are sitting at home, isolating, worried about the trajectory of this disease, and just knowing that we have great professional care at Boulder Community Health. So just applaud you and your team for the work. Well, let me just ask, so moving from here, we've been through now this very difficult crisis for our community internationally. What is the vision that you have for Boulder Community Health going forward for the next 100 years?
Well, my vision is hopefully, and I believe it is the same vision that the community has, that all the people that make up Boulder Community Health, and certainly our board has. But that vision was refined about 7 years ago now, And we got together with community members and board members, and we had a vision statement, but it was longer than the pages on the floor there, and no one could remember them. And so we narrowed it down to a sentence, and it's partnering to care for and create the healthiest community in the nation. And we were intentionally aspirational. We believe that this community, in many ways it is, and certainly should be the model for communities across the U.S., but we also have a lot of work to do around health equity and preventative care and social determinants of health, and now catching up for all the care that was unmet during the past 2 years. But we really believe that together we can create the healthiest community in the nation. That also means preventing loss of health. But it starts with the word partnering for a reason. As important it is for us to be independent, that independence only succeeds through strategic partnerships and thoughtful partnerships with all the nonprofits in the community, with our chamber, absolutely with our community, and making sure that we invest in where the needs are. And so the vision remains the same. I would say the last 2 years, and then culminating in the kickoff of celebrating 100 years, if anything, has just reinforced that vision and the importance of achieving that. And so the vision hasn't wavered. I think we've doubled down on that commitment and continue to do the things that we've done. So, for example, a direct outcome of that vision was listening to the community, hearing and understanding the mental health needs and the lack of services that frankly, across the nation, and unfortunately, even more so in Colorado, and through the incredible support of our community and donors, and particularly led by Lou Delicava and others, we built a $50 million mental health facility, and it's that really is a direct outcome of a commitment to our vision and to making this the healthiest community in the nation.
It's beautiful, and I know we've talked about it before, but that's in its essence, it's not a profit center for a hospital, so it's an amazing commitment for an organization. But
actually, a hospital is not a profit center for a hospital.
Yeah, that's a good point.
Yeah, it's tough.
Okay, so you're not noodle some money. Yeah, no, but it's a good point.
But it is balancing those things.
Yeah,
it's balancing, and frankly, and we say we're nonprofit, but we have to make enough money to cover expenses, and then a little more that we can invest in the best technology, the best docs, the best providers. And we've been fortunate to do that, but it isn't without the tremendous support of the community. And just an incredible example of that is the celebration of the Hoovers' $5 million gift last week to support our staff, to enhance their education and their wellness. And you can't have a healthy community, and you can't be a great provider unless you have a healthy staff and a healthy group of providers. So it just continues, and there's a lot of exciting stuff.
Yeah, it's amazing, just the vision to address a great community need, and to see the community come together to support its hospital and addressing it. So we talked about the vision, but then reflecting on the past again, wondering what does 100 years for Boulder Community Health mean to you?
Well, when you have that legacy, if anything, it really brings home the responsibility, and not just the responsibility to be there if someone loses their health or for their emergent needs. And honestly, I spent my career as an emergency physician prior to this, and I like to look back and think that I made a difference. And often it was one patient at a time. But when you look back at the 100-year legacy and the people that are walking around today and contributing to our community, or without pain, or the suffering that's ended, or the lives that are here because of just something as simple as the vaccine clinic, you realize the importance of what this means to the community and the future. I just came back from Washington, where I was meeting with a number of legislators to help promote and support the healthcare, both here locally. Sure. And I walk in Joe Naguse's office, who's another example of an incredible supporter of the hospital and in our community, and sit down with his staff, and his staffer says, I was born at BCH. And I can't tell you how often you run into people and that's their story and their legacy, including many of our board members. And so it really just makes it clear how important that legacy is in terms of the responsibility going forward and the responsibility we have for everyone that's here and the future generations, and achieving that aspiration of being the healthiest community in the nation.
Yeah, I love it. Beautiful legacy that we have here, and then obviously the opportunity going forward. And I'll just say this, that as a leader of business association here in our community, we recognize the economic impact that Boulder Community Health has to our community as well, and just thankful for the steady hand that you lead or have in leading the healthcare facility in our community, and proud also that it is a standalone independent hospital organization. So just wonderful to have you here and celebrate with you the 100 years. I will say that our board wanted to make sure that they also participated in the celebration. And so we passed a resolution.
Wow.
And it says, I won't get into the all the whereases because there are a lot of them, but it's a resolution recognizing the impact of Boulder Community Health in our community. And so I'll just read the final line. And it's now therefore be it resolved by the Board of Directors of the Boulder Chamber that the Boulder Chamber congratulates Boulder Community Health on its 100th year anniversary and offers thanks for its positive impact to Boulder's economy, its health, and quality of life. And so I present this to you among, I know, many other honors that the hospital and healthcare system has received, but I just so appreciative of the work that you and your team do in our community. And just wonderful having you on Boulder Chamber Chat. And so we'll just leave it there, but always important dialogue here and learning about our important businesses and organizations. So we'll see you next time on Chamber Chat.